Welcome to Skyscape's free webinar series. Today's topic is NCLEX Preparation in the Classroom and Beyond. I'm Kristen Snowden-Smith from Skyscape, and I will be the moderator today. This webinar is being recorded and will be available on demand with a copy of the presentation. We will notify you when it's available via email. If you have any questions during the webinar, please send them via chat. We will have a Q&A at the end of the webinar. Our speakers today are Karen Sherrill and Verinder Bawa. Karen is an educator in Phoenix, Arizona. She teaches in pre-licensure programs focusing on scrambled learning with the use of technology, student success, and the integration of clinical judgment model. Her motto is, "If we finish class and your brain doesn't hurt, I haven't done my job." Verinder Bawa is the product and sales veteran with a global perspective, having worked in the US, UK, and India. He currently leads product management at Skyscape, where he identifies mobile technology that solves the needs of one of the most vital links in the healthcare system. His motto is never stop learning. I will now hand the floor over to Karen.
Thank you, Kristen. I appreciate your welcome today, and I appreciate Skyscape inviting me to present on this topic. I have to tell you, it's one of my very favorite, and it's been so exciting to see the changes that are taking place at National Council, and I look forward to sharing with you some ideas and strategies that you can take into the classroom. So first, as we look at our overall objectives for this hour, what we're going to be focusing on is taking part in looking at some preparation for NCLEX. How do we prepare our students? What can we be doing differently to best prepare them? Looking at both the program benefits and also the student benefits that come from the focus on NCLEX and the success of that. We're also going to talk about some instructional design principles that promote higher order of thinking in students. So we can't talk about NCLEX without talking outcomes. If you have not ever gone to the National Council's website and looked at these statistics, it's critically important that you do. Know that these outcomes of measure come out quarterly for the program, and this particular snapshot you see is for 2020. The October through December outcomes are not yet posted, but if you are looking at this webinar in archive, you might go to that website because the current information is probably available to you. It should be out anytime now, I would anticipate. What is important about this information? First of all, what it tells us is that our US educated RNs and PNs, first-time test takers, have the highest probability of success when taking the NCLEX exam. When you look at other categories of students, whether that's a repeat tester or whether that's a student that is internationally educated, you can see that that percentile cuts in more than half of what the first-time US educated nurse is going to be successful, or their rate of success in taking this exam. That's really important to us as educators. What this is information telling us that we need to reinforce with our students. It is critical that you pass this test the first time you take it. The probability of you being successful the second time is far, far less. We also can see this comparative information when you're looking at your repeat testers, you're internationally educated, and there's very likely a correlation between those two, because I know my experience and a lot of the information published in the literature shows that repeat testers are commonly our weaker students. Many times those are students that are not native to the US, maybe speaking a different language or coming from another country originally, and they're challenged with the educational process in the US and nursing programs especially. So take this information, share it with your students, but look at it for the power that it has in knowing that we have to be prepared and have our students prepared to pass this test the very first time they take it. So our first polling question I would like to ask the group, Kristen's going to bring up a poll for us here, but I want you to share with us, what is your program pass rate currently? And you have 5 different options to choose from. You can see on your screen the survey itself. So go ahead and I'll give you a second to click in whichever one is most appropriate to your program, or if you don't know what your pass rate is, then there's option 5 for you to select. So I'll give it just a second for those tallies to come in. Why is our program pass rate so important to us? Well, we know that a lot of times will determine our accreditation. We know that that's a very important piece. We also know that it's going to determine how fast we get our students into the workforce. So, Kristen, how are the numbers coming in?
I think we have about 75% of the people have answered, so we'll give them another second to go ahead and answer.
Okay.
And then I'll close it here. So one last moment to put in your choices and I will close it. I'm going to close it now. Let's see, yeah. And then I'm going to share so you can see. Can you see it?
I can. Just came up. So, in looking at the tallies, there is a certain percentile, a little less than 20%, that aren't real sure what their pass rates are. Fortunately, the largest percentile of the survey includes schools that have 86% or greater, which is wonderful information, very much to be proud of. I anticipate that if you're in a school that has 85% or below, you're probably a little concerned. And there's certainly some quarters that these numbers are better than other quarters, and we watch the numbers fluctuate. But we recognize that our school can be put into, accreditation could be at stake. There could be some potential violations, and we might have some accreditors on our back or our state board on our back. Part of the reason why I wanted to bring this up, and I would love to think that we are always achieving a 95% plus in our pass rates, but I believe almost every school in the country has had times that they're below that. And the reason why it's so important is because of the changes that we have coming forward and the concerns I'm going to share with you in a few minutes as to why I'm afraid some of those pass rates are actually going to start dropping in the next few years. Like I started to mention earlier, it's important for us to have those adequate pass rates, maintain our accreditation, make sure that we have a great reputation in the community. Students out there will choose their school of nursing based upon the reputation that that program holds. And we want to know that our school has a good reputation in the community so that we can in fact recruit more well-qualified nursing applicants. Students, of course, the faster we can get to a positive NCLEX outcome, the higher income potential for that student, and more importantly, it gets them into the workforce, which especially during these difficult times is so very important for us to be producing good quality, solid students and nurses. So what can educators do to prepare students for the NCLEX exam? I encourage you to become familiar with these concepts and documents. First of all, the practice analysis. Practice analysis is the survey that is taken by National Council. They send survey results to 12,000 new nurses up to 18 months out of school. And they have those students rate what they do that is most important, what they do that is done most frequently, has a strong emphasis on fundamentals. This published practice analysis is on National Council's State Boards of Nursing website, and it is very detailed in giving you information to best prepare your student. Oftentimes, I will look at those top 10 most important, most frequent practice analysis reports to put together my simulation for my students or my case study information or whatever learning activity we're doing in the classroom. I focus it on those top items from the practice analysis so that I know what I'm teaching in my classroom is coinciding with what they need to know in order to be a successful nurse. I want to download and print off the test plan, which is going to provide to me the client needs categories, talk about the integrated processes. Again, RN and PN test plans available on National Council's website. And it's also important for us to have conceptual-based understanding. If you're in a conceptual curriculum or a concept-based curriculum, that's very different than conceptual learning. Conceptual learning allows the student to look at things very globally. And more important, we want to make sure that we have reality-based learning. So students are using actual patient information in order to put together the pieces and parts they need for our classroom activities, our lab activities, simulation, and as well as applying that information at the clinical bedside. What are some of those pieces that are aligning in the upcoming few years? And I think yesterday or the day before I referred to this as the Bermuda Triangle. It feels like everything is coming together all at one time. This PowerPoint, I started out calling it the future situation of nursing education, but I actually changed it to the present situation of nursing education. And the reason I did that is because we look at this and the dates are in the future. And we're sitting here thinking, 2023, that's a while before we're going to see these changes take place. But the reality is the students that graduate and take next gen items, they in fact are going to be sitting in our classroom this fall, or they're currently sitting in our classroom, depending on the length of your program. So what are the things we need to be preparing for? First of all, the RN test plan, which should be coming out in 2022, has been delayed a year to 2023. The reason for that is because the practice analysis survey was put off a year as a result of COVID. They did not want to perform, they being National Council, did not want to perform a practice analysis on new grads working in COVID hospitals and COVID agencies. They didn't feel that it would be appropriate information or most realistic information as to what the new grad encounters, because the healthcare institutions are so stressed right now. Put off the practice analysis for a year, therefore the RN test plan rollout will now occur April 1 of 2023. It is still up in the air as to whether or not there'll be a logit change at that time. And if you've been in academia for long, you know that the logits is how it's basically the pass rate. The last time we had a logit change, it was pretty traumatic to many nursing programs across the country, caused many programs to have their accreditation at risk because of the increased failure rate of students. It wasn't that the exam was more difficult, it's that the rate of passing was increased. That will also be considered for April 1 of 2023 for the RN test plan. We also have our next gen rollout occurring sometime in 2023. It has not been specified, at least as of today, when exactly that's going to take place, but that is still the goal. They are on track for that rollout. We also have the third piece of this Bermuda Triangle, which is our global pandemic that we are currently experiencing. And some of our preliminary research shows that there is substantial stressors causing lots of burnout to the current nursing workforce. I anticipate in the next year or two, we're going to see nurses leaving the bedside as a result of the physical and psychological stressors they're encountering right now. And there is research that is supporting that. We also have students within our nursing program that are learning online. Many schools are limiting or having no clinical experiences for these students because there's not availability in the communities as a result of COVID. So of course, the result we have is we're graduating students that have little to no clinical experience. And this, of course, is going to lead to an extended period of time needed for that new grad transition. In order to create those safe practitioners, they're going to have extended new grad orientation times and transition times, which means they're going to be a slower rollout of the students that we have going into practice. So let's think about the nurse as a learner, the student as a learner. How students have learned to learn in the past is based a lot on memorization. The students that we have coming from our K-12 education system, the students that we have in our requirements for our nursing program, whether that be the science courses, the English courses, the chemistry courses, their learning is based on memorization. And the problem with that is if you're memorizing things, then you're not applying thinking, you're applying and learning facts. And although you need facts to learn the foundation, what we have to transition to is that higher level of thinking where we have our students Think about things from a clinical judgment standpoint. They have to take that foundation of facts, put it into practice so they're making safe bedside decisions for patients. So how do we do that? Well, how do we do that is simply by addressing it with every student in every class, every single semester. Know that it's not what a student knows, but it's how they know it. Your students have to be challenged with answering the question, why? Why? Don't just regurgitate a fact out of your textbook. Associate it to why they know it and how you know it. So for example, I see that you put 2 liters of oxygen on your patient, or you're suggesting that. Why did you choose 2 liters of oxygen and not a basic mask, a simple mask? Those kind of questions require higher level of thinking. We need to make sure that our students are processing appropriately, that they're using thinking pathways. We cannot teach in linear lines, but we need to have our student teaching in algorithms, in concept mapping. We need to be constantly giving additional stimuli so that they're putting these parts and pieces together. We want to integrate fundamentals, and we need to make sure fundamentals is integrated throughout the curriculum. In a 3rd or 4th semester student needs to be taking questions about how the liver failure patient who's on lactulose has diarrhea, and we need to be concerned about skincare. Constant reaffirmation of those fundamental concepts are important for these students in order to pass that exam of safety. And we need to be formulating habits. How do we do that with our students? Lots of repetition, constantly forcing them to think bigger. So clinical judgment is really, National Council has taken a huge stab at this over the last few years, created some great research and some great models. Again, I encourage you to read the articles and publications that are available on their website, but they've recognized that there's a huge gap between practice and academia. And it is so important, especially for our novice nurses, to start learning the process of clinical judgment, since they're not able to safely practice at the bedside. And we have significant research showing us that they make a huge quantity of errors as new grads, and the ability to make sound clinical decisions. We need to make sure that we're reinforcing that continually through the program. So what are the 6 steps of the clinical judgment measurement model? This is, again, publications by National Council, and hopefully you have seen this before. But what I encourage you to do is break down each of these steps into very purposeful learning activities for your students. Use this terminology so students are comfortable with it, and it's going to make again, purposeful learning, which is so important. I'm going to take you through a few examples of how you can make that happen. So first of all, when we recognize and analyze cues, we need to teach our students to see very subtle changes. This is not going to be maybe overt changes, but it's going to be something subtle. And those are the differences between life and death at the bedside. Think of that nurse at the bedside who has a patient who's short of breath, but they don't really do anything about it. Or what if we have a patient at the bedside who's short of breath, but has the vital signs in this image on the screen? Now, if we measure and look at that concrete data, many times students or new nurses will say, hey, there's not a problem. Everything is normal. But the thinking nurse who's making clinical judgment decisions has to go back and say, there is something wrong. My patient's short of breath. I need to question the information that I see on the screen because something's not right. I need to dig deeper. I need to investigate further. Looking at the information, determining, is there a concern? What is the worst piece of information that I see? Is this information indicating a patient's improving, or is it indicating a patient's condition is worsening? And those are very important pieces that our students need to be recognizing. So how do we create habits of cue recognition and analysis? Practice often, practice early. Start with fundamentals. Start the process of cue recognition in the fundamentals semester of your class, of your program, and have students constantly recognizing cues. Now you can do this through, say, an environmental scan of the lab. Get your students into the habit of walking to the lab and to look around, do a quick environmental scan to see if there's anything there that's wrong. Could there be a Foley catheter bag sitting on the floor? Could there be a call light that's fallen off of the edge of the bed and the patient can't reach it? Have your students identify those cues the minute they walk into that lab setting. You can also perform this during class. There's 3 patients with Crohn's disease. What cue is most concerning in each scenario? I love doing compare and contrast patients, whether that's a classroom activity or lab or simulation. Get your students to compare multiple patients. It might be multiple patients with the same disease, or it might be 3 different patients with 3 different diseases. Either way, that's more realistic to the bedside. It's pretty rare that you've got a nurse that has 1 patient a day. We don't take care of patients in silos in the hospital. Students are going to be expected to care for multiple patients at one time. So present them with 3 different situations to see if they can recognize and identify those cues. Be very overt and purposeful. Okay, class, right now I want you to do a cue recognition and analysis. Take a look at what cues do you see? What cues do you see in this case study? What cues do you see in this lab setting? What cues do you see in this exam test question? And make sure they are being forced into consciously looking at those details. Another great activity, use a 3x3 card. Have your student in the clinical setting looking for cues that allow them to safely delegate care and why. So your student at the start of their clinical day, everybody gets a blank 3x5 card. You have them complete this and bring it to post-conference. They're going to either present it to the entire clinical group or they'll present it to a peer, but they're going to get feedback on what it is they observed. So in that clinical setting, the student has purposeful cue recognition taking place, and you can give them a different assignment each clinical day for them to recognize cues of things happening around them. We also can use our Skyscape materials in order to create those habits for cue recognition. Students, using the case study we presented, now I want you to open up the lab book on your handheld device, on your phone, and I want you to go into the study mode, and I want you to take a look at this case study, and I want you to look at maybe some lab values related to it, or I want you to explore some potential cues or problems this particular patient would have. If you need additional resources, use your tools in which to find those, because that's going to support your cue recognition. I can have students going into the lab guide, and I can have them reinforce what's important and what's not important. Now, cue recognition of a normal or abnormal sodium potassium level is probably easily done for a student in 2nd, 3rd, 4th semester. But if you've got a student in fundamentals class, they might not know what is normal or abnormal. So have them open up their devices, open up their phones, go into their resources, and see if they can justify cue recognition on the different cues being presented to them. The next step 3 of the clinical judgment measurement model is prioritize hypothesis. And I see these and try to reinforce this in my students in actually 2 separate steps, especially when they're still learning the processes of clinical judgment. So first of all, prioritize, prioritize, prioritize all the time, everything the student does. Which client would you see first? Which action would the nurse perform first? Which vital sign is first? Which med is first? I'll tell you a secret in my class, and I teach 3rd semester med-surg. Students oftentimes, when I say, okay, what's the first thing the nurse is going to do when they enter the room? And the common answer is assess vital signs. Assess vital signs is never the correct answer. My question to them is, which vital sign? There's a reason why a nurse walks into one room and checks a pulse ox first, and there's a reason why a nurse walks into another room and checks a blood pressure first. I want students to take it down to the detailed level of cue recognition to identify which vital sign is most important in this scenario. So constantly have detailed prioritization taking place. Break down the steps into one tiny baby step at a time. The second half of prioritized hypothesis is just hypothesizing, brainstorming. What could be happening? Why do you think that? What complications are occurring? So when given a set of data or a set of cues and information, have students think way outside the box. Don't just automatically assume it's one thing, but let's brainstorm together all the possibilities that could be happening with this patient at this moment in time. And you can use this process whether you have a student caring for one client. You can put them in a different scenario by having them care for multiple clients, or you can make plans and have them work within teams. So how do I create habits of hypothesis? Well, send your students to their resources. Okay, students, I want you to hypothesize the information. We've just collected a bunch of cues. We've got a lab report. We've got a farm record, pharmacology record, a MAR. We've got a history and physical. Now I want you to use your resources, start digging into the information within those to determine what are possible problems and potential complications for this client, given the information you have. Next, I'm going to generate solutions, and generate solutions I see as listing nursing interventions and medical interventions. We need to make sure our students are doing both nursing and medical interventions. I think as we start the nursing program fundamentals, we're really good about teaching nursing interventions. As we get into the later semesters, we gravitate towards medical interventions, and we oftentimes forget the more simplistic nursing interventions and the decisions that the nurse can make at the bedside. If I've got to hang an IV, change an antibiotic, and I need to intubate my patient, that's well and good, but there's not a lot of things there that the nurse can do. So have your students, again, use their sources, generate solutions, come up with a list of solutions for this client in this situation, work in teams, work in pairs. If you're teaching online like I am right now, put them into a breakout room. Put students into a group of 3 or 4, have them go into the resources and come back to the class with a list of solutions that can be used, both nursing interventions and medical interventions that are important in the care of this client. Take action is actually what the student is going to do. Now, this is great. If you're in clinical, it's easy to take action. If you're in the lab and simulation, it's easy to take action. If you're in the classroom, it's a little bit more challenging. But we can reinforce this in many different ways. And one of the ways in which we can do this is by observation. We could show a video and have students focus on what actions the nurse took that are really important throughout the shift. If our students are in clinical, what did the nurse intervene incorrectly? What did you see the nurse do? See if they can keep a journal or a log of actions that were appropriate and actions that were inappropriate. Do a compare and contrast, bring that to a post-conference, post it on a discussion within your learning management system. Come up with a variety of ways in which students can be recognizing the process of taking action. Make sure we're forcing our students to do things in class, and do things is to actually touch and handle and do things, but it's also to think through those processes and to apply clinical judgment continually. So what are some habits for taking action? Again, several different examples here. Have our students in class get up out of their seats, pair up, pull out their phones, open their MedSurg Clinical Companion and Skyscape, review the priority nursing interventions. Again, online learning, put them into a breakout room, have them do the same thing. After they review the clinical companion, complete 2 assessments, 2 interventions, and they can use clinical imagination to do this. Clinical imagination is taking place in their head, but if you want to see them physically using clinical imagination, give them a blank sheet of paper and just say, write it out. Write it out the way the nurse needs to be performing it. I love to do this in my IV skills lab the first day after they have performed an IV push and a piggyback in the lab on a mannequin. I give them a blank sheet of paper at the end of the day. I give them a brand new math problem, and I have them write out the steps without referring to any material. That's using clinical imagination of how I would walk through those steps without my cheat sheets and without my policy and procedure manual. Am I retaining that information in my mind? And again, when you do this, give students a time limit. That adds that context piece that Next Gen talks about and clinical judgment talks about. Give them a time limit to complete these activities. Then it just doesn't go on, but say, breaking you out in your groups for this activity. I'm giving you 5 minutes. I've set the timer, go. Send them to their breakout rooms, call them back in 5 minutes, see how much they were able to accomplish. The last step of clinical judgment is evaluating outcomes. And one great way to do this is to have students evaluate themselves and their understanding. Spend 10 minutes of your class allowing students on their phones to take NCLEX practice items. Use that information for them to self-evaluate how well they're retaining the material. It will allow that student to self-critique. It'll provide you with some input outcomes from your students. And it also shows your students that you value these products and that you find that there's value in them, which is going to encourage them to do this more outside of class as well as in class. So quickly, in the next couple slides, I want to talk to you about improving outcomes. And this is a great case scenario. We've got a student named Katie. You probably know Katie. My guess is that you have a few Katies in your program. She's in her second semester. She makes an appointment with you. She failed her first exam. She said, in high school was easy. I never had to study. I don't know how to focus my study. What can you suggest? An important piece of Skyscape tools is their value in remediation. So encouraging Katie to do a variety of things in order to improve her outcomes. Form a habit of studying. So she is consistently studying the same place on a consistent basis, putting it on her calendar, has that set in stone. She's going to have some conscious study time. Encourage Katie to focus on top 3 priorities. Don't just memorize the facts out of your reading. Think about the patient that has Crohn's disease and list the top 3 assessment findings. List the top 3 nursing interventions. List the top 3 medical interventions. Focus on the top 3 priorities of care. Chances are that's what she's going to be tested on. So that is where she needs to think about prioritization and what is most important in the care of the patient. Have Katie go into her multiple NCLEX options within her Skyscape program, taking 50 to 75 questions a week. She might use the question of the week by Skyscape. She might download the NCLEX prep exam app. She might use one of the textbook resources that are available. 50 to 75 questions a week is critically important to developing testing skills. And Katie, as well as all of her classmates, need to be doing this. Make sure Katie's performing and preparing before class by reviewing the material. That allows Katie to come to class and ask high-thinking questions. That's the time for that. You don't want Katie to come to class and say, I don't understand what congestive heart failure has to do with renal failure. Why is there a connection between poor left ventricle and poor perfusion to the kidneys? Class is not the time to ask that. What she wants to ask in class is, what will I assess in a patient that has poor left ventricular function, decreased perfusion to the kidneys? What will be my assessment findings that I'll see in my patient? That's high-level thinking question, and that's going to allow Katie to perform at a higher level. She wants to be sure to summarize her readings after each section, and again, use those priorities of care to do that. She should be reviewing her notes within 24 hours after class. That's when the greatest retention takes place, and that's when she is going to be able to retain that material. She's going to be able to clarify questions she has in her mind during that early phase with her short-term memory, remembering what the discussions were in class. She needs to participate in an effective study group. An effective study group is one that has a conscious plan. They don't just randomly get together and say, hey, let's just go through what we talked about in class last night, but they have a purpose. A study group that comes to study group with a pre-prepared case study where they've already worked on it, and they spend their time comparing their answers. That's an effective study group. And of course, we want to refer Katie to campus tutoring services, make sure that she is getting all the resources that she needs to be successful. I'm now going to turn the demonstration over to my colleague Verinder, who's going to show you some of the amazing things that the app offers.
So I'm going to talk about a couple of apps that we have from Silvestri. There's one is the RN app, the other one is PN app. Both of the apps have thousands of practice questions. The RN app also has 25 next-gen questions, so you can kind of review the structure and so on. And we're introducing this concept of preparedness quizzes that the students can take to figure out their knowledge gaps and so on, which I'll touch on in a second. This is what the home screen of the app looks like. And here what we have is study section. In the study section, what the student can do is put in the date for the exam. If the exam is a couple of months away, the app will recommend that you do 100 questions per day. And they can also set a timer for how much time they would like to spend per day. And they can also set an alert, say, okay, remind me at, say, 9 o'clock in the morning to start studying. And then once they get started, the app gives them random questions, and then we're working on an algorithm to improve the random questions so that the questions are kind of based on a certain criteria and the knowledge gaps. They can attempt a question, they do submit, and if they get the correct answer, they see the rationale. We also have a unique feature called Ask an Expert, where they can reach out to an educator if they don't understand the rationale, and the educator will get back within 24 hours. They can also bookmark a question for review later on. For example, if they think there's something tricky about the question, they can bookmark it, and they can also add notes to the title. They can add the text notes, which they can review later on. This is kind of effectively creating a flashcard. So once they've, I'm going to cancel out of this. So they can kind of pick questions, like, so they can also, one of the unique features of the app is the app allows you to attempt questions multiple times rather than kind of give you the answer straight away. So once they answered a few hundred questions, there's another mode on the app, which is the stats screen. So in the stats screen, what it showed them is that the number of questions they answered. Obviously, I'm just getting started up here. They can go to the incorrect answers and review those questions at a later date. They can also go to the stats screen and look at different question types. And Karen mentioned earlier that like prioritization is important. So the app has this reorder type of questions. They can go to the reorder type questions, and then the way this is basically, so you can drag and drop, and you can select the question, drag and drop it, and reorder the answers, and then you submit, and then the app will tell you what the correct answer is. So these are some of the features in the app. I'm not going to, we don't have time to touch on all of them, but if you connect with us, we can kind of schedule a more detailed demo. The other thing I'm going to talk about is faculty resources. So accompanying these apps, there's a faculty dashboard for both their titles, and the faculty can drill down in the dashboard, and they can, if they go to the RN title, they can actually find, so for example, if you have a concept-based curriculum and you want to find questions related to anxiety, you can go in to the app, and these are like a question you can use in the classroom, you can use in your teaching. So, so that's one way of using the dashboard. The other thing is that if the school adopts the platform, the school can create cohorts. They can add students into the cohort, and they can review students' progress report. And so that they can kind of review the cohort progress report. These are like, for example, the students in the cohort. They can go in and see what the students are doing. They can see where the student is struggling. And again, it tells you what the question was, what the student's answer was, and what the correct answer is. What else they can do up here? They also have we have this concept of a hardest question. So these are like the 3 of the questions that most students are struggling with. Again, you can see what the question, the correct answer, and so on. And these are some of the cues you can use to kind of home in on the particular student, or you can home in on to see, is there something that's not resonating with the students, and you can change your teaching style. So Kristen, this is the tip of the iceberg. There are a lot more features, both for the faculty resources on the dashboard and for the students. And again, the app is free. It comes with sample content. You can download it from the Apple Store or Play Store, play around with it, and so on. So Kristen, I'm going to hand control back to you.
So what we're going to do right now is we're going to open up to some question and answer. So if you have a question, please go ahead and type it in the chat window, and it will show up and we can answer your questions. I have a couple of questions from the floor that came up during the presentation. Bina asked, is the NCLEX testing nursing diagnosis? I'm not really sure what she meant by that, but
I can address that, Kristen.
okay.
National Council of State Boards of Nursing does not test nursing diagnosis. In fact, if you look at their ADPI model, AAPIE is what they use, not ADPIE. So they've eliminated the D of diagnosis. They use assessment, analyze, plan, implement, evaluation. So the answer to that is no nursing diagnosis is on the national exam.
Great, thank you. Let us know if you have any other questions, Bina. Another question we had from the floor from Julie was, do I need to change my lesson plan to use these tools?
So, and Verinder, feel free to step in, but let me give my opinion first anyway. And my answer would be, you don't have to change your lesson plan. I would suggest that you enhance your lesson plan by using these tools. So what you might currently be doing is lecturing a section of material, but instead during that lecture, have students introduce them to a case, introduce them to some cues that they can analyze, and then have them open up their devices and see if they can find and search for the information that's needed. So I really see this as an enhancement to your current nursing lesson plan and not something that needs to be revisited. Doesn't matter whether you're teaching in a disease-based model or whether you're in a concept-based model or whether you're in a competency-based model. It's all going to be the same in the way in which we're applying this information. Did you have other thoughts on that, Verinder?
Yes, so I was going to say the Silvestri Comprehensive Review title come with the study chapters as well. And each chapter has questions at the end, which you can use in your existing lesson plan. And again, we have this question filters where you can kind of assess students based on whether you have content-based or concept-based curriculum. You can assess students, set assignments based on either one of those methodologies.
Great, thank you. I think you may have touched on this, but someone's asking, what semester is best for implementing an app or the book or anything NCLEX like study tools?
So my opinion is they need to be started on the first day of nursing school, and they need to be created into a habit. And the only way we can make a habit is by starting early and doing it often. So Absolutely, it cannot come early enough. If you have the ability to touch your students prior to the nursing program, whether that be through some of your prerequisite courses, I would even encourage you to get them started on these resources before they go to their first day of nursing school. Because again, it's going to create those habits, and that's exactly what we want them to do.
And then if you look at the study chapter in the Silvestri app, there are some fundamentals questions as well. And often get asked, okay, where do I get NCLEX questions for fundamentals? Again, they can be found.
Great, thank you. Someone also asked what the cost of the app is, and the app is the list price for the Silvestri RN version is $55. The PN version is $50, and we also have bulk discount programs available for institutions and subscription options for individual students. We've also recently partnered with the Elsevier publisher, who is the publisher of the Saunders Silvestri titles. So if someone has purchased the book, they can go into their Evolve resources and they can get the app at a discount. So it is an additional charge, but it is at a significant discount. So anyone who has purchased the book, not used, and has access to Evolve, if they go into their student resources, they'll see how to do that. Those are all of the questions I have right now. I don't know that anyone else has, nope, no other questions. Any final thoughts, Karen?
Nothing that I haven't already said. I just can't reinforce enough the importance of implementing these strategies, I think, in everything that you're doing. It's going to improve our outcomes and produce great nurses and produce them quicker. So I encourage all of you to work harder at making this happen. But thank you. Thank you for inviting me today.
Thank you. Verinder, any final thoughts?
No, I think there is an NCLEX question of the week that we publish. It's a free service. I think we forgot to touch on that. The link for that is nclex.skyscape.com. The question is renewed every week. Try it out. And
then they're also shared on our social media channels. So follow us either on Facebook, Twitter, LinkedIn, Instagram. I want to thank everyone for taking time this afternoon to join us. We hope you found this informative. If you would like to learn more about Skyscape solutions, feel free to email sales@skyscape.com. Some of the resources referenced in this webinar were the Saunders Comprehensive Review for NCLEX RN and PM, NurseThink, the NCLEX quizzing app, and the NCLEX question of the week. If you would like to try or evaluate those, you may email us at sales@skyscape.com or go to the page you saw in your email in the invite, and you can download them and email us there as well. To learn more about all of the Skyscape offerings that we have, you can go to education.skyscape.com. As I mentioned at the beginning of this webinar will be available on demand in the coming days, and we will share that with you via email. The slide deck will go with it, and you can see all of the past webinars that we have on demand at skyscape.com/webinars2021. If you think of any additional questions, please feel free to email webinar@skyscape.com. Thank you and have a wonderful afternoon.
Listen, before you hang out, the certificate of participation will be awarded. You just have to reach out to us.
Yep, that too. So if you want a certificate of participation, it's not any CE units, but feel free to email webinar@skyscape.com. Have a great day. Thank you.
Thank you. Bye.